Good afternoon. Today we shall take a class on pin retained restorations. Pin retained restorations were a very popular system of gaining retention and resistance, especially when you do direct filling restoration. Now you have many new materials, new bonding agents, bonded restorations, which have superior qualities than a pin retained restoration. So the use of pin retained restoration has slowly faded out, slowly going out. So you should know about what is a pin retained restoration. How was this restoration used in the earlier days, and what is the advantage of the newer restorations over this type of restoration? What was the failures of this pin retained restoration? So coming to the definition, a pin retained restoration is defined as any restoration which requires the placement of one or more pins in the dentin so as to provide adequate resistance and retention form to the restoration. Now, as you all know, amalgam, when you do a amalgam restoration, the tooth preparation, the preparation you do should have the convergence or occlusal convergence of your preparation or a parallel walls, so that the amalgam restoration gains its retention from it. And same way, the features of resistance form and retention form. So if you do in a tooth which is grossly decayed or extensive decay of the tooth is there, you may not be able to attain this retention or resistance form by your normal tooth preparation. So in such conditions, you may have to place one or more pins into the dentin, which in this picture they show you that a pin is being placed into the dentin, and part of the pin extends into the restoration outside. So when you place a few pins in dentin and partly it extends out into the restoration takes the retention or resistance form by the pins. Now, what are the indications for pin amalgam restoration? First one is extensive tooth loss. As I told you earlier, if there is a large caries lesion, and when you're going to do a amalgam restoration, after you prepare the tooth structure, when you remove all the caries, when you remove all the weak or unsupported enamel which doesn't have a dentin support inside, weak enamel, when you remove all that, you may not be able to attain the retention that is required or the resistance form that is required to hold the restoration in position. In those conditions, you are going to place a few pins inside the dentin. So extensive tooth loss is the first indication for pin amalgam restoration. Second is if the tooth has a poor prognosis or questionable prognosis, that is, the tooth is periodontially not healthy, or the tooth doesn't have adequate root form, there is resorption in the root surface, but the tooth is stable and this caries. In that condition, you may have to either go for extraction, or you may have to either go for extraction. But if you want to retain the tooth, since the tooth doesn't have any mobility or any significant pain or anything, you want to retain the tooth for some more time. In that case, you cannot go for an expensive restoration like a crown or a full coverage restoration. In that condition, you can place pin and do amalgam restoration, which is less expensive. So a tooth which has a questionable prognosis can be restored with a pin amalgam restoration for some more time. Give it a lease period for a few more years or months, and after that you can extract the tooth because you haven't done a very expensive restoration on the tooth. Third is as a foundation for indirect restoration like onlay or crowns. So when the tooth is extensively decayed and for doing a core buildup, you try to attain the retention or resistance required, you may have to place these pins and do a restoration over it. And above that, you can give a onlay or full coverage crown. Then fourth indication is economics. A pin retained restoration is less expensive than a bonded restoration or a full coverage crowns or some metal crowns or ceramic crowns. And so when the patient is economically slightly poor, cannot afford expensive restoration, you can go for a less expensive restoration like this pin retained amalgam. Then next one is the age and health of the patient, especially for geriatric or debilitated patients. Now, when the patient is old patient, or patient is not healthy, is physically handicapped patient, or such patients may not be able to come for multiple visit treatment. So PIN amalgam restoration can be done in a single visit. So the number of appointments or the number of visits the patient can have to make to the clinic can be reduced by giving a PIN retained restoration. So those patients which are physically or mentally weak, patients who are aged and cannot come multiple visits, you can consider giving a PIN amalgam restoration. Now coming to the contraindications for PIN amalgam. Now, first contraindication, patient is having occlusal problems. This PIN amalgam is not indicated restoration because excessive force bruxism, patient is bruxis, excessive occlusal pressures given on the restoration, PIN amalgam restoration usually fails. So in these conditions, PIN amalgam is not a indication. You can go for full coverage crowns or any other restorations. Then second is aesthetics. Certain patients are very considerate about the aesthetics, the color of the restoration. A PIN amalgam is definitely not an aesthetic restoration, and for in a PIN on a PIN, doing a composite above it also doesn't give much of an aesthetic. So aesthetic patient always a bonded restoration, a bonded ceramics, or bonded composite restorations are better restoration. Then next contraindication for PIN amalgam is the access difficulties. Certain tooth, rotated tooth, or partially limited mouth opening cases, certain inaccessible areas of the tooth, you may not be able to place pins due to the inaccessibility to the area. In those conditions, you can you cannot consider a PIN amalgam restoration. Same way, like I told you, abnormal crowns or root contour. Abnormal crowns, which is very narrow, very close to the pulp, you may not be able to place a pin without injuring or damaging the pulp. Same way, if the root has abnormal morphology, sometimes when you place a pin, you may perforate into the periodontal space. By looking at the X-ray, if you feel that the tooth is this contour of the tooth or crown, root or crown is not adequate, you may not be able to place a pin. So that is also a contraindication. Then very young patients who have a very large pulp chamber. In those conditions also, while placing the pin, there is chances or possibility of perforating into the pulp. This condition also you may have to avoid placing pins. And even active caries. It's similar to the same patient has multiple caries in the mouth. and it's not under control. In those cases, patients, you do any type of restorations, it's going to fail within a few days or months. So in those cases, you may have to control the caries rate, give a temporary restoration till the caries is under control, and then consider doing any other restoration. Especially pin retain restoration have multiple interface, so chances of caries or caries progression or micro leakage, secondary caries, all that is very high in a pin amalgam restoration. Now coming to the advantages of placing a pin. Now the advantages of placing a pin for amalgam is, first is tooth conservation. Pins provide retention without extensive cavity preparation. That is, as told earlier, you don't have to unnecessarily remove tooth structure to gain attain resistance or retention for the restoration. So you just have to make a pinhole and place pin that will improve the retention and resistance. So you're conserving the tooth structure when you do a pin amalgam. So that is a very this thing. Even bonded amalgam, you don't have to unnecessarily remove tooth structure. You will be removing only the caries tooth or caries tooth structure, and then doing a restoration. So always tooth conservation should be given the first priority. Then, as told earlier, the appointment time. Pins are usually done in a single appointment. You don't have to. Usually, you can do the cavity preparation, tooth preparation, make the pinhole, place the pins, and do the restoration above it in a single visit. It may take a little time, but in a single visit you can do all this rather than inlay, onlay, or crown or extracoronal restoration, which are done in multiple visits. So that is a very that's a good advantage of pin amalgam. Then resistance and retention form. By placing the pins, definitely the resistance and retention forms are improved. But pins within limits. If you place more number of pins, more in excess of what is required, chances of reducing the retention and resistance is also there. But within limits, if you place the pins, you're going to increase the resistance and retention. And same way, economics, I told you, pins are less expensive than any other indirect or cast restorations. Now, coming to the disadvantages of pin amalgam, first is dentin and micro cracks. So pins definitely cemented pins or friction lock pins or self-threaded pins all create creases in dentin, internal stresses in dentin. Cemented pins cause minimal craze, but other two create a lot of stresses and strains in the dentin. So chances of micro cracks forming and injury later on fracture can also happen by placement of pins. Then fracture resistance of pin amalgam is lower than the cast. So usually tooth restored with pins have more chance or more likeliness to fracture because these stresses are high, internal stresses, fracture resistance are lowered. Then strength of the amalgam restoration is also reduced. When you place few pins, the bulk of the amalgam, the stresses are created in the amalgam. So chances of the stresses in amalgam can lead to the fracture of the amalgam restoration. And then micro leakage is seen in all pin retain restoration at the pin dentin interface. Usually, I told you there are multiple interfaces when you place a pin. That is the interface between the pin and the dentin, interface between the pin and the amalgam, and the interface between the amalgam and the dentin. So all these interfaces, there is likely chance of micro leakage and chances of secondary caries or pin failures. Then perforation is another disadvantage of pin placement. So when you place these multiple pins, there is chance of perforating the perforating the hole into the pulp or into the periodontal space. So whenever you place a pin, you should be very cautious. You should be able to evaluate on the X-ray where you're going to place the pin, whether there's adequate dentin in between. All that should be considered because the chances of perforation is also very high. Then difficulty to achieve proper contour. In a complex situation, it is difficult to establish the good contour and occlusal anatomy of using the pins. So the to contour to attain it, it's difficult. But if you may have to do a good carving polishing to retain the occlusal anatomy or the proximal contact and contour of the tooth. Now coming to the types of pin, there are basically three different types of pin systems. One is a cemented pin, next is a friction lock pin, and third is a self-threaded pin. Now all three have its merits and demerits. Now coming to the cemented pin. This pin was introduced into dentistry by Markley, and it's also called Markley pins. Now Markley, he introduced this in the year 1950. Now this pin, cemented pins are made of stainless steel and have threads of serration for better retention. In the diagram you can see the pin is placed into the dentin, and usually the depth of pin into the dentin is around 3 millimeters into dentin, and 2 millimeters remains out to support the amalgam over it. Now the pin diameter may be of various sizes. It can be up from 0.018 inch to 0.3 inch, and the pin channels are usually larger than the pins. So the pin channels are 0.001 to 0.002 inch larger than the pin. So usually the pin hole is larger, not usually. In cemented pins, the pin holes are larger than the pin diameter. So here, what is the advantage? Stresses are comparatively less. When you hear about the other pins, you'll know why the stresses are less here. Because when you make the pinhole, it's larger, pinhole is larger, and you place the pin inside, pin freely moves inside. And you use a cementing media like zinc phosphate or zinc polycarboxylate cement for luting the pin into the dentin. For luting so the stresses on dentin are comparatively less when you use this cemented pin. And the advantage is easy to place less internal stresses, and it's less retentive than the other types of pins. So that is about the cemented pins, and usually you get this in these are the two systems available, star and Beck systems you have. Then usually the star has two, the twist drill is 0.021 inch, 0.2024 inch, and the pin is smaller than the drill. So when you make a hole with a 0.021 inch drill, you place the 0.018 pin inside it freely. You know the diameter is larger of the pinhole, and the pin is having a smaller diameter. Then back you have two sizes, 0.025 and 0.027 drill. Twist drill means the drill that is used to create the hole in dentin for the pin. So when you use a twist drill of this size, you can place a pin corresponding to that twist drill. Okay. Now coming to the second type of pin, it's called the friction locked pin. Now in friction locked pin, it is Dr. Goldstein in the year 1960. Friction locked pin was introduced in the year 1966 by Dr. Goldstein. Made of stainless steel and have threads. Here the pinholes are, pin is larger than the pin channel. That means the pinhole is slightly smaller than the pin size. And friction locked pins are tapped into the pin channel with a mallet. So unlike the earlier unsymmetric pins, the pinhole is larger, but here the pinhole is slightly smaller than the pin diameter. So when you place the pin above it and you'll have to tap it, due to the resilience of dentin, the pin moves into the pinhole, but it creates a lot of stresses into the dentin. So it is usually 2 to 3 times more retentive than the symmetric pin. Your dentin must be present around the pin as they generate great stresses in dentin, causing dentin crisis or craze lines. Now here you have 3 different sizes. Two different types, Unitec and Beck. Here the twistril is slightly smaller than the pin. Here you can see 0.021 is the twistril size, 0.02 is the pin size. When you're using it is 0.021 and 0.02 is the pin diameter. You tap the pin inside.